There is an important conversation going on every day throughout the United States, both in homes and in workplaces and in schools, about this thing called healthcare. There's a lot of change occurring in healthcare at the moment. Is healthcare affordable? Is there a sustainable future for healthcare in this country? But fundamentally, the issue is about what type of healthcare do we have access to? Is it affordable? Is it effective? And is it safe? It's interesting that one of the biggest challenges we have here in the United States is the cost of healthcare itself. And that's caused a lot of angst for families and people all throughout the nation. In the United States, we spend more money on healthcare per person than any other country in the world. When you break it down, it's more than $8,000 per person per year on healthcare, and the next nearest country in the world is Norway at around $5,000. With that amount of spending, we would expect a great return on that investment. We would expect and hope that people would be healthy as a result of that. However, that is not the case. We know there's a lot of concern amongst families and employers and people who go to work and for our children about the cost of healthcare and about where insurance fits into that model. And in the last year, we learned that 1 in 5 people who are currently working are paying off a medical debt. 1 in 5 people who are working. And interestingly, the 1 in 5 of those people, 78% of them had healthcare insurance. We're very blessed to live in this country where we have the latest technology, access to the greatest intervention, the greatest doctors, the greatest minds, and the greatest tests available known to mankind. And some of these tests and examinations and procedures turn out to be life-saving for us. We're very lucky and very blessed to have that opportunity. However, the crisis care approach to health is only one aspect of healthcare. And for people to be healthy, we have to look at health other than just an economic discussion. My concern is the people I meet every day who want a healthcare system to be affordable, they want it to be safe, and they want to get great results. What a concept, a healthcare system that's affordable, it's safe, and it gets great results. So where would you look for that? Well, I don't know we're going to look for that in Washington because our system is so big, it's so complex, there's so many players, and I guess so many vested interests that maybe we have to look somewhere else. Thousands of people in this country, thousands of people every year are harmed and injured at the side effects of prescription and overprescription of medications. Again, these drugs are wonderful used appropriately and in the right context. But more and more people are taking more and more drugs. Just to give you an indication of that, we know that in the United States we have about 5% of the world's population, but we consume or use 50% of all the drugs used on the planet. For that kind of use or utilization, you'd expect or hope that we'd be healthy. And when we compare ourselves to other countries, we're not in the top 10 countries in the world of health outcomes. We're not in the top 20 countries in the world. We're not even in the top 30. And I read recently that a baby born in the United States this year has a lot higher probability of living to the age of 1 in 45 or 46 other countries than the United States. So in spite of our technology and immense spending, it's not producing the health outcomes. So let's look at solutions. The real question is, what is health and where does it come from? As a parent, when my children were growing up, they had a choice about what they could drink. They could drink water juice or water juice with ice. Of course, kids always chose the water juice with ice. Why? It was more fun, they could play with it and so forth. We offered to feed them fresh food as often as possible, gave them fruit and vegetables, things out of the ground, rather than processed and food that might have come from an animal source. And one of the key things was getting our kids outside, getting them moving, getting them playing and getting them moving and stretching their bodies. And we know that in the United States now, the average child spends 6 hours a day in front of a television or video game. So the body needs to move. It needs to have the right fuel. It's awesome to be in a loving environment. And of course, there's challenges with siblings growing up and financial pressures and work pressures. But the better the body can adapt to our environment, the better we can deal with those stresses. And we know the avenue that we live our lives is through the nervous system. The master control system of the body, brain, spinal cord and nerves, are the conduit between the organs, the cells, the tissues, the muscles and the brain. And that feedback loop is absolutely essential to life and having a fun-filled, healthy life. So the role of a chiropractor is to ensure that that nervous system is clear of any interference. We know the spine, made up of 24 moving bones sitting on top of each other, move and are susceptible to misalignment. So the value in a chiropractic adjustment isn't just feeling better. The value of chiropractic care is not just getting back to work or getting on the sports field, but the value in regular chiropractic care is, in all probability, with all other things being equal, you'll have a healthier, happier and more productive life.